So Mario, I thank you so much for joining Carbon Convos. And we're here to talk about HIV prevention. It's June, so it's not only Pride Month, but June 27th is National HIV Testing Day. So it's important for people to know their status, their partner status, and this is for everyone, not just people in the LGBTQ plus community. So Mario, first, tell us what you do.
Thank you. So good to be here with you today, Wendy. I appreciate the opportunity to share. My name is Mario Harper, and I lead the U.S. Business Action to End HIV. Our coalition is comprised of really impactful corporate entities who are wielding their influence, utilizing their resources, forming collaborations, and sparking innovations that can help drive sustainable change that ultimately will result in us ending the domestic HIV epidemic in the US by 2030. So very excited about the work and excited to be here with you today.
How is it going so far? How are those efforts going?
It is going incredibly well. We are only in our second year of existence. This is an initiative of the Health Action Alliance, which is the country's largest employer network operating at the crux of business and public health. We translate opportunities for employers to engage their workforces and communities on pressing social issues, but also workplace well-being issues, up to and including HIV, but also where it intersects with mental health and climate change and all of these other conditions that we face as a society. We started this organization or this initiative with 14 member companies, and we've since grown it to nearly 50 companies. And we are full steam ahead, creating programs and resources and events that will bring additional employers into this effort and look for ways that they can have an impact both internally on their workforce, but also externally on the communities where they have a footprint.
Okay, thank you. So since you're doing this work, I feel the answer to this question should be obvious, but in terms of working on eradicating HIV, do you think that's possible?
It's absolutely possible. We live in an unprecedented time and era where we have all of the requisite tools necessary to effectively end the epidemic today. We don't have a cure, but we have a de facto cure in the way of prevention through PrEP or pre-exposure prophylaxis, as well as HIV treatment medications. And all of these biomedical interventions have created a situation where if a person knows their status, they're able to take advantage of that opportunity to empower themselves and take care of their empower themselves and make sure that they are taking the appropriate next steps.
So, well, for instance, I learned recently that in St. Louis, Black women are the population with the highest rate of new HIV infections, and it's likely happening in other similar cities. What are some of the reasons for this?
There's so many reasons that this could be the case. Black women represent a marginalized group. They represent a group that's vulnerable to HIV, as you've mentioned. There's some theories around this, but then there's also just some factual information as well. HIV disproportionately impacts communities across the South and disproportionately impacts Black and Brown communities as a whole. I think the latest CDC data revealed that 9% of women make up 9% of people with HIV. And of those 9% of women, 50% of them are African-American, when we know African-Americans don't make up even half of that total as far as the general population is concerned, right? And even less for Black women. And so when we're thinking about reasons they could be left out of this discussion or out of this the fix, it's because there's lack of education, right, that are reaching them. Black women are often, not just for HIV, but for other chronic conditions as well, left out of clinical trials. They're left out of conversations that can lead to an advanced resource deployment. And so those are some general reasons. There's also reasons around, there's a threat to be considered where Black women are unknowingly contracting HIV from men who have sex with men who are also in a committed relationship with women or having some level of intercourse with women, right? And so for stigma and other reasons, those men don't know their status, thereby being able to transmit the virus to some women in the African American community. So I think there's also a thread of religion, right? And that being a barrier to wanting to know what's on the other side, or wanting to confront what the potentials or the possibilities are. And so we really have to tap into our faith-based organizations, as well as our employers, to be able to disseminate some of this messaging that can really help Black women understand what their opportunities are for prevention measures, and even for treatment, but also understanding what is happening around them, right, as it relates to this phenomenon, and not just this one, but others as well.
So what do you think are some of the missing pieces in terms of getting this information to Black women? And I mean, because we're in the age of information, you have the world at your fingertips with your phone. So many people are on social media, not necessarily everyone, but so many people utilize social media. So many people are consuming TV where there's advertisements and public announcements. What is the missing piece in terms of bringing more awareness to this issue for populations like Black women who are so disproportionately affected?
It's a great question. I don't think there's one piece, right? There's so many great organizations that have been doing incredible work in communities for a very long period of time, and that continue to stand up the HIV infrastructure as it relates to supporting vulnerable communities. I think you made a great connection as far as thinking about social media. I think influencer culture can play a huge role. We need our Black leaders to step into those roles and be advocates in this space. Aside from that, though, there's a common thread, right? Most people in this country have to work to make a living, right? And so what's the common denominator for someone who's working? You have an employer, right? And the thesis of all of the work that we do here at the Health Action Alliance, to include this U.S. Business Action to End HIV initiative, is all threaded with the needle of what's called the Edelman Trust Barometer. And that barometer is an international survey that's conducted every year, and it's asking employees who they trust the most to give them reliable healthcare information, right? That's actionable, who they trust to convene the proper stakeholders, who they trust to address health equity issues and root out inequity and all of those things. And year over year, this barometer this survey is skewed toward employees trusting business more than any other source, whether that's a non-governmental organization, whether that's media, et cetera. But even beyond business, at a 76% clip, they are saying that they trust their employer, right? Let's double down on that, right? So if they're trusting their employers, where do most health insurance plans come from? Comes from the employer at a clip of almost 50%, right? And so there's a natural relationship there that can be leveraged, right? And so there's an opportunity for employers to come in and educate, provide resources, to engage in destigmatization efforts, demystifying efforts as it relates to HIV, to make sure that they're reviewing their benefits and making sure that they're comprehensive and they cover PrEP and HIV services, right? That they have great non-discrimination policies in place. Those that have robust government affairs teams, that they're advocating for policy that maintain HIV resources and support the HIV infrastructure because it's impacting their vulnerable communities. And then that they have a relationship with the communities that these employees come from as well, right? And that they are engaging, that they're bringing people in from the community to do educational trainings, to do lunch and learns and things of that nature, and really leveraging fully that relationship. I also think, and I mentioned this earlier, faith-based organizations have an opportunity, right? To not turn a blind eye to what's happening in the communities that they serve, and realize that the whole of the person, the whole wellness of an individual should matter in these arenas, and be forthcoming about what's happening to these communities. I mean, there's a huge disparity between white people and Black and brown people when it comes to HIV transmissions. And so the fact that our faith-based communities seem to be, in some situations, not all, there's some incredible faith-based communities that have embraced this issue and are running incredible ministries that support these individuals and communities. But then there's a larger sector of them that are not and are completely turning a blind eye to it. And so there's an opportunity for them to level up that engagement.
And I wanted to know, those faith-based organizations who could be seizing this opportunity to get the word out, to providing communities that are supportive. It's so unfortunate that so many people who are being affected by HIV are not being welcomed by certain faith-based organizations or churches. It can be a very critical space where even if a church or a faith-based organization were to begin offering support in this area, they still may not be trusted. That person still may not want to go because they've had poor experiences in the past. From the conversations that I've had with a lot of people in the LGBT community, it's not that they don't have faith or practice their faith, but they don't want to be in an organized religion where their identity is going to be discriminated against. And so do you have any thoughts on that issue and what needs to happen in order for that to change?
I have a lot of thoughts on it. I don't know if I have a prescription for the change per se, because I think that's unique to those entities, right? And how they practice the dogmas of their respective,
History of
congregation.
those beliefs, and
Sure.
there's just so much stigma, and that's one of the bigger questions. How do we break down this stigma? Because that is a huge factor, if I am correct, that plays into people becoming infected because people aren't having the conversations because there's stigma around
Absolutely.
the situation. So
Absolutely. Yeah. And I think, the overarching objective of, I can't speak for them, but I would think the overarching objective is to save the soul, right? And it's going to, it's not to save the soul today, it's just to save the soul, whatever it takes. And so you got to nurture the individual in order to ultimately get to be able to save the soul, if that's what the intention is. And so I would hope that these faith-based organizations would lean in and support all members of their communities, because regardless of how you feel about how a person, who a person loves, and what types of quote unquote sins they engage in, if you would, it doesn't put them beneath any or above any of your other parishioners or members of your organization. And I think there's a level of support that needs to be provided for all members. So,
thank you. So again, regarding stigma, do you think there's any messaging that could potentially decrease the stigma around HIV in terms of education, people knowing really, how it's contracted? It's not just a medical phenomenon within the LGBT community. People are living with HIV. It's not the death sentence that it was, 30 years ago. What messaging do you think would be helpful in destigmatizing having HIV?
yeah, thank you for that question, and thank you for the insights that you shared about it. I fully agree with all of them. I think there have to be more positive portrayals, right? And so one of the programs that media has a lot to do with how we perceive, people, conditions, places, things, etc. And so one of the programs that we've created under this U.S. Business Action to End HIV initiative is a media and entertainment cohort, right? And we are partnering with GLAAD and Paramount Pictures to center and have more positive portrayals of people with HIV, but not just people with HIV, HIV possible characters as well, because as I heard you mention, this is not just an LGBTQ plus disease, right? This is something that's possible for anyone, right? It can literally happen to anyone. It doesn't have a designation for who contracts it, right? And so getting that word out, but also, as you said, getting the word out about the fact that we no longer are in the 1980s. We have the most powerful tools available. And what's interesting to me as we talk about the stigma of it, the stigma has arrested all of us to the point where we don't understand the opportunity that we have. If you were talking about any other chronic condition, and I told you that we literally had every tool right now to end cancer, right? Like no one else will ever get cancer again because we have all the tools available. Do you think we would have all hands on deck trying to make sure everyone understood how to prevent themselves from getting cancer?
Yeah.
I think so, right? Like it wouldn't even be a question. Like all hands would be on deck. We're literally telling you that about HIV, right? We're literally telling you that because of prevention tools, because of treatment tools, because undetectable equals untransmittable, right? All of these things, no one has to ever contract HIV again, even without a cure, right? At this day and age. And so that's the goal, that's the objective, to get that messaging across. But like you said, we're going to have to find the right knife to cut through the stigma because that stigma is so present. And, you know, I'm always trying to put myself in other people's shoes as well. And as a gay Black man, and, you know, my closest friends are similar to me, they're gay Black men as well. And sometimes we sit down and we think about, you know, the days where we didn't have the requisite knowledge to protect ourselves, right? Like we didn't know about PrEP, we didn't know about any of those things. And sometimes we call it the grace of God that got us to this point, and that we're still here and living and breathing and able to reach back and try and educate the next generation and help other people in other ways. But when we think about what the largest barrier was to us not wanting to know or not, and we're all college educated men, right? And so it's not that we're incapable of knowing. We had stigma was stronger than any other force that we had to compete with us making sure that we took care of the whole of our person, right? That we allow stigma to prevail over all of that. So when I think about it and put myself in other people's shoes, it's not just that the stigma's so bad on an employer's end or on a faith-based organization's end. That stigma resides in all of us, right? And so the admission of that is freeing, right? Like being able to have a conversation and see someone else's vantage point and say, yes, I recognize how this might be difficult for you, but can we consider this, right? And so I really like to make that point. We have to meet people where they are, and we have to create a ladder of engagement for them that makes sense so that they can take the next step, because we won't do this in quantum leaps, right? There's got to be a process by which we can engage all of the proper stakeholders and educate them on what the potential is, because the truth be told is that until it knocks on someone's door, sometimes it's hard for them to really have a personal relationship with it. Sometimes it's hard for an employee to think that it exists in their workplace, right? And so the evidence of that can be an effective tool for making sure that we bring everybody along.
Thank you. And we were talking about yourself and your group of friends, and at that time, not having the same level of information that's available now, not having the same access to the information that's available now. For instance, was it challenging to even ask your medical provider about, I'm concerned about this. What should I know? What should I do? What should I not do? Was that a challenging conversation, around that time when you and your friends were still figuring things out?
Not only was it challenging, it didn't happen.
Mm.
I'd never learned how to advocate for myself on my own. I was so fortunate to have a dear friend who's still a dear friend to me, who was in the thick of things during the 1980s, lost several partners, lost several friends to the HIV epidemic. And I can still remember very vividly him going to me to the Philadelphia house in Shreveport, Louisiana, and holding my hand as I was able to articulate what my needs were to a physician, right? And began the process of me taking ownership of my life and learning about HIV. And so, that type of advocacy, it takes a lot of that as well. But you made me think of another facet of this, is the cultural competence of physicians, right? And that plays such a huge role. And for most of these physicians, no, HIV won't level up to diabetes in their practice, or it won't level up to heart disease in their practice because of the level of incidence. but there is still a need for cultural competence, or at least access to physicians who are culturally competent. And one of the ways that we've been able to usurp that, I've lost both my parents at a young age. I lost my dad to cancer. My dad had a totally treatable cancer, and so his death was completely preventable. But as a Black man, my dad had a level of mistrust for the medical community that was so profound that he took his chances on, not addressing what he knew was becoming a dire situation, right? And so, one of the things that we've created or helped to create here under this coalition, another cohort, was a retail pharmacy cohort. Because in Black communities, oftentimes a pharmacist is more trusted than a primary care physician. And that's just the truth of the matter. Primary care physicians are wonderful. They obviously have a need. And if a person was to be found to be positive for HIV, then obviously there would need to be a linkage to care that would take place. And that person would need careful care coordination through an infectious disease doctor, primary care physician, et cetera, right? So we're not trying to rule out any particular specialty of medicine. However, we do have to operate where the trust exists, right? And so if pharmacists can practice at the top of their licensure, and they have proven that these test to treat models work through COVID and in other ways, and they're oftentimes the most trusted individual when it comes to advocating and providing culturally competent healthcare resources to an individual. And this person is showing up. There's social determinants of health that are eradicated because they're within a radius of this person's home that is accessible to them, and they have an understanding of the conditions that these particular communities might face. Then we have to leverage those relationships, right? And so those are just some of the ways that I feel like some of that advocacy, self-advocacy, can take place in trusted environments with advocates and people that can hold your hand throughout those processes until you become fortified enough to feel comfortable doing that for yourself, with the help, obviously, of a good care team that is culturally competent.
Yes. So in speaking of medical providers, what responsibility do you feel the medical community has in destigmatizing HIV and AIDS?
I think they have an incredible responsibility, and I think again it starts with the cultural competency and leveling up again their knowledge of what's facing all communities, right? And so I think there's an opportunity for not only physicians, but I think there's an opportunity for organizations that organizations and institutions that are doing this work to really level up that education and opportunity. I know that Duke University is doing some incredible work with Walmart and making sure that their pharmacists are HIV specialty trained, right? And so I think that's an incredible example of them walking the talk, right? But I also think just from a research perspective as well, like making sure that there's an inclusion amongst groups, right? Specifically those vulnerable communities. I think you attended our National Employers Summit, and I think you heard Dr. J. Bott say, the margins teach us, right? And so I don't think there could be a more true statement, right? We can't be left, the margins can't be left out of all of the data compiling when they're the ones who actually teach us, right? Like we need to make sure that we are including all communities, Black and brown women, Black gay men, everyone into these trials, into these studies, and making sure that there's an advocacy arm for them as well.
Why do you think that so many Black and brown people are left out of clinical trials? I was in an asthma study late last year. I saw a message about it on Instagram that was connected to a local hospital here, and I entered that. But that was of my own volition. I mean, it did pay, and it paid well. And maybe that might be the piece, like letting people know, you actually get paid to be in this study. But are the information about these studies just not coming our way? What needs to change?
Yeah, again, I'm not an expert in this arena, but I have thoughts. Obviously, I think there is a level of mistrust that exists still with our community and being guinea pigs for Tuskegee experiment and so forth and so on, right? Like I just think that there's still a sour taste. So I think there needs to be some um, there needs to be some mending of fences,
Yes.
if you would, as it relates to that. And then I think there's an outreach mechanism to, just like you found out about the asthma trial. I think there needs to be some outreach mechanisms to make sure that there's proper inclusion, and there
Yeah.
needs to be a nurtured process to getting individuals from diverse communities, but specifically vulnerable communities, to understand what the opportunity is, how it impacts them, and it doesn't hurt if there's proper um, payment for their time and energy. Yeah.
Yeah. And also probably culturally competent messaging, if that is a concern among some populations that these clinical
Mm-hmm.
trials want to start to target, then the
Mm-hmm.
messaging needs to be more tailored to those concerns.
Yeah, and I think you sort of hit on it earlier as well. It matters the vehicle that it's coming from, right? So maybe utilizing influencer culture and others to disseminate some of that messaging and leverage the trust that they already have with the community. So
Thank you. So lastly, I would like to ask, what do you think that the public can do to help destigmatize HIV and AIDS?
I
Unless you
think the public,
question.
yeah, I think the public could. I think the public at large is very undereducated about HIV, which is not. Um, I'm not casting an aspersion on anyone, right? Like it's okay to be undereducated about things that you feel like may not impact you. But the truth of the matter is that it can and it will most likely, whether it's you or whether it's someone you love. There's 1.2 million people in the U.S. With HIV right now, according to KFF data, right? And there's over 35,000 new annual infections or transmissions. Pardon me. Um, and so with that, it will impact most of us at some point in time in our lives. So I think, taking advantage of opportunities to educate, I think uh, volunteering for things, but the biggest thing that you can do is just be an advocate, right? On your jobs. One of the things that we do here at the US Business Action in HIV is we engage ERG groups. ERG groups are intended to be resources for different affinity groups, whether that's Black, Latino, women, aging populations, you name it, right? And so these ERG groups have an incredible opportunity to advocate for these vulnerable communities, specifically Black and Brown communities, um, and make sure that HIV is raised as an issue in the workplace. Again, most of us have to work to make a living. And so if you're hearing about it on a place where you're clocking in at least 8 hours a day and clocking out, there's a good chance that you won't miss it and it won't be competing for your attention with other things. And so I think when we think about how the public can help with demystifying HIV, I think it's understanding that, again, we have all of the tools available to effectively end the virus today if we all took advantage of it. And so that in and of, if everyone just owned that messaging, right? Messaging is so important in every aspect of life. And so understanding how to get the right messaging, not taking anything anyone says for, as if it's gold, but educating yourself so that you make sure that you understand, and treating everyone like a person, right?
Yes.
Regardless of their status, right? Everyone deserves to be treated like a human being. And I think that's the main thing. If I hadn't said anything else today, the main thing is that everyone deserves to be treated like a human being, and for everyone to just remember that.
Yeah, absolutely. Well, Mario, thank you so much for joining Carbon Convos. I really appreciate it. And I think viewers will learn something. And I think this will help people who see our conversation um, think about HIV if they haven't or haven't had to, and think about getting
Mm-hmm.
tested or having the conversations that they haven't had, etc. So the more awareness around this topic, I think, the better. I think the more awareness will definitely get us to that goal of eradicating HIV, because as you have said, it's definitely possible. So thank you so
Absolutely.
much for your time.